When found to be in a dangerous emergency, the suggestions of those closest to you are the first to spring to mind. However, sometimes the most widely accepted advice is actually rather harmful. Did you know icing a bruise may make it worse? And picking up an unconscious person might be dangerous? In this video, we will explore different survival tips and myths we must do to save ourselves and other people from harm. Number 1. Don't lift an unconscious person. Lift the person up and splash some cold water on them if they pass out, right? Most individuals probably think that. However, the spasm will get far worse if you try to raise a fainting individual. Do not let them stand up once they come to. Instead, prop up their legs, undo any restrictive buttons on their clothing, and keep them lying down. And don't give them popular beverages like coffee or energy drinks after they've come around after losing consciousness. Drinking caffeine will simply make them thirstier and more dehydrated. Number 2. Never set a bone yourself. Do you work as a trauma surgeon in your profession? If you don't know what you're doing, never try to reset a dislocated joint on your own. I don't care how amazing or brutal that seems on television. It might lead to further harm and lawsuits. The wounded limb is recommended to be immobilized, and emergency medical services are contacted as soon as possible. Immobilize the limb by wrapping it in a bandage and splinting it in a comfortable posture, preventing movement at the site of the potential fracture and the two nearest joints. Number 3. Don't force yourself to vomit when poisoned. In cases of poisoning, the traditional advice is to induce vomiting. Although it seems sensible, it is really prohibited. To begin with, the toxin might enter the respiratory system and cause harm there instead. Another issue is that if you were to become chemically poisoned and then vomit, you would be in twice as much danger because you could burn your esophagus. Last but not least, it may be difficult to stop vomiting once it has begun, which can result in dehydration and other serious effects. The most prudent course of action in this predicament is to make an ambulance call immediately. Number 4. Never pull an object out from a wound. Now, you might know how to remove a splinter from your finger or maybe a little piece of glass from your hand, but you should never try to remove anything from a deep cut. Not even physicians remove them before operating on a patient. What happens is that the object is stopping any bleeding from starting while it's within the wound. Do nothing, then, until you're able to do so under the guidance of an expert, do not even think about touching it. The only thing that will help is if you put alcohol on the cut. However, you should brace yourself for a great deal of pain. Even though it seems like a knife is embedded in your leg, it's just a splinter. Stop trying to be a movie star and just go get yourself to the hospital. Number 5. Stitches aren't the only way to close cuts. In most situations, using stitches is not that bad. Unfortunately, stitching up a wound is a time-consuming and often painful process that must be repeated once the wound is healed and the stitches have been removed. The use of less extreme measures may be effective in some circumstances. Skin glue is very easy to use and doesn't cause any discomfort. Before applying adhesive to the wound, wash it with cold water. Then, apply pressure on the wound to halt the bleeding. Apply the skin glue to the wound's edges to seal them. Never attempt to treat a wound on your own if you think it could be serious. Instead, seek medical attention immediately. Number 6. Never rub a feverish person with vinegar or alcohol. As the blood absorbs both vinegar and alcohol, this is a potentially inebriating method of making salad dressing or getting tipsy. For real though, putting alcohol on your skin will get you drunk, and adding vinegar can significantly increase acidity, which is especially bad for kids. You shouldn't listen to such stale nuggets of wisdom. Take in plenty of non-alcoholic drinks such as water, tea, and juice. Reduce the room air temperature to between 16 and 18 degrees Celsius, about 61 to 64 degrees Fahrenheit. The patient will recover from the fever on their own under these circumstances. They need to go to the doctor if they don't. Number 7. Don't treat burns with sour cream or butter. However, the fact that it reduces discomfort is often cited as proof of this technique's success, which begs the question, why do butter and sour cream have this effect? One catch is that we store them in the refrigerator, making them very cold when applied to a burn. Butter and sour cream pose a risk since they both dry up your skin and prevent your body from cooling itself. Thus, the skin will be more damaged because the heat has nowhere to escape. Put your hand in the water and hold it there for about 15 minutes. The discomfort caused by the injury will be lessened by this. Do you know why our bodies form blisters at the site of a burn? Things always unfold as they should. Infected wounds are kept safe by the formation of a blister. If the protecting layer is removed, festering might occur. Number 8. Avoid applying warmth to a spring. A sprained muscle cannot be helped by applying heat through a warm cloth. The heat will only increase blood flow, which will cause more severe swelling in the first several days following the accident. You can reduce the swelling and the discomfort by applying cold. It is recommended that the sprained limb be used as little as possible for the first 48 hours. Number 9. How to save a drowning person. The ability to swim is the only thing standing between you and saving a drowning person. If you have that skill, nothing can stop you. Be sure to sneak up on them from behind so they don't see you coming. If not, the panicked individual could get in your way or even drag you down. Once you're close enough, grab the individual under the arms or by the chin and drag them to the beach while having their head tucked under your tummy. Number 10. Don't apply ice to a bruise the wrong way. It's not improper in theory to use ice on a bruise, but the vast majority of people do it poorly. If you don't want to risk a cold burn, avoid putting ice straight on your skin. Instead, use a towel between your skin and the ice pack, but keep in mind that you might still get burned if you try to use a cloth. That's why it's best to only ice for 20 minutes at a time and then to rest for 90. No ice should be used at any point. As painful as a bruise may be, it beats the hell out of a cold burn, and we're sure that you'll agree. You should also be aware that ice has no beneficial effects after the first 48 hours have passed since the injury. Did you find any of these tips helpful? Leave your thoughts in the comments section below. The more people who know what to do in an emergency, the better off everyone will be. So please share this video. Thank you for watching. We hope you enjoy our videos. We invite you to subscribe, like, and hit the notification button as we upload several new videos weekly.